A heart attack doesn't happen all at once. It unfolds in stages, minute by minute. And understanding exactly what's happening inside your body during those minutes could genuinely help save a life, maybe even your own. Let's go inside your body, minute by minute, and see exactly what a heart attack really is, and the early signs most people miss. A heart attack, medically called a myocardial infarction, happens when blood flow to part of your heart muscle is suddenly blocked, usually by a blood clot that forms at the site of a ruptured plaque inside a coronary artery. These arteries supply your heart muscle with oxygen-rich blood. And when that supply is cut off, the affected heart tissue starts being damaged almost immediately. This is fundamentally different from your heart simply stopping. A heart attack is about blood flow being blocked to a specific area, while your heart is often still beating. In the first couple of minutes, symptoms often begin subtly. Chest discomfort, often described as pressure, tightness, or squeezing, rather than sharp pain, is the most recognized sign. But here's what many people don't know. Symptoms can also include discomfort, radiating to the arm, jaw, neck, or back, along with shortness of breath, cold sweats, nausea, or lightheadedness. Importantly, symptoms can differ significantly between individuals, and women in particular are more likely to experience less classic symptoms, like unusual fatigue, nausea, or back pain, without prominent chest pain, which is part of why heart attacks in women are more frequently missed or delayed in diagnosis. 1. Oxygen-starved heart cells begin struggling almost immediately. Heart muscle cells require a constant supply of oxygen to function. Once blood flow is blocked, the affected cells quickly switch to inefficient anaerobic metabolism, which cannot sustain normal function for long and produces byproducts that contribute to the pain and distress signals your body sends out. 2. Cell damage begins within minutes and becomes harder to reverse the longer it continues. This is the core reason time is so critical during a heart attack. Affected heart muscle cells can begin sustaining real damage within as little as 20-30 minutes of blocked blood flow, and this damage becomes progressively more extensive and less reversible the longer blood flow remains blocked, which is exactly why immediate medical attention matters so much. 3. Your body activates emergency stress responses. As your body senses this crisis, it releases a surge of stress hormones, including adrenaline, which is part of why heart attacks often come with a strong sense of anxiety or impending doom. A genuinely recognized symptom, not just a psychological reaction, and often one of the earliest internal signals your body sends before more classic symptoms fully develop. 4. Your heart's electrical activity can become unstable. Damaged heart tissue can disrupt the heart's normal electrical signaling, sometimes leading to irregular heart rhythms called arrhythmias. In some cases, this can be dangerous enough to require immediate intervention, which is part of why timing matters so critically during this window. There's a well-known saying in emergency cardiology: time is muscle. The longer blood flow to the heart remains blocked, the more heart muscle tissue is permanently damaged. This is exactly why getting to emergency care as quickly as possible, ideally within the first hour, sometimes called the golden hour, is so critical to limiting long-term damage. Medical treatments like clot-dissolving medications or procedures to physically reopen the blocked artery are specifically designed to restore blood flow as quickly as possible, directly limiting how much heart tissue sustains permanent damage. If you or someone near you experiences symptoms that could indicate a heart attack, chest discomfort, unusual shortness of breath, pain radiating to the arm or jaw, cold sweats combined with nausea,
an ambulance.
the single
He's
most
having a heart
important
attack.
action is calling emergency medical services immediately, rather than waiting to see if symptoms pass or trying to drive yourself to a hospital. While waiting for help, staying as calm and still as possible reduces strain on the heart.
Panicked
Chewing an
gasping
aspirin,
will
if
only
not
make it
allergic and if
worse.
advised by emergency
Listen to my
dispatchers,
voice
is sometimes
and slow
recommended
down
because it
your
can help
breathing.
slow clot formation. But this should be guided by medical professionals in the moment, not assumed as a universal first step. Here's the honest truth. Heart attacks are often portrayed dramatically in movies. Someone suddenly collapsing, clutching their chest. In reality, many heart attacks build gradually over minutes, sometimes with symptoms subtle enough to be mistaken for indigestion, anxiety, or fatigue. Recognizing the less obvious signs and acting immediately rather than waiting is genuinely one of the most important pieces of health knowledge you can have. So, could you recognize the less obvious signs if they happen to someone near you? Comment below if you learned something new today. If this video could genuinely help you or someone you love, hit subscribe, because tomorrow I'm covering the 9 warning signs your liver sends before serious problems develop. Continuing this series on signals your body sends that are too important to ignore.